So it's been a little while since we've made one of these videos, and the reason being is we've just been sitting around and waiting. Well, that patience has finally paid off. Shayna is actually the greatest patient in the history of haplo bone marrow transplants here at Johns Hopkins University, and here's why I say that. Initially, this was supposed to be a 60-day process post-transplant. I made a joke before we came here telling the doctors that I thought Shayna would be out of here in 56 days. They laughed and said that wasn't gonna happen. Well, on December 9th, Shayna gets to go home, and that will be day 55 post-transplant. And the reason she's getting to go home early is because how well she has responded to the treatment. So a couple weeks ago, they ran, I think it's called the chimerism test, maybe chimerism test, I don't know. But basically it's a test to see if she still has any of those mutated cells in her body, which she does not. She is now 100% donor cells. So over the last few weeks, we have just been doing a lot of hanging out, walking around. We seem to end up at Whole Foods every day because it's right next door. Just trying to be really patient. About 2 weeks ago, they started giving her breaks. So instead of having to go in every single day to get her blood work done, we went to every other day. And now we are at maybe twice a week. As of our last visit, which I believe was yesterday or the day before, Shayna's platelets are sitting at about 220. They have gotten as high as right around 300. Now, to give you an example of how high that is or how far she has come, when she initially went into the hospital back in April, her platelets were at 22. So the normal range for platelets is between 150 to 350, I believe. So 22 is super low. Well, now she is well in the normal range. Also, her hemoglobin, the day she went into the hospital in April, I think she was sitting at about 3.5. Today, she is a little over 8, and the normal range for that, I believe, is somewhere between 9 and 12. So she's very close to normal as far as her hemoglobin, and the white blood cells are even starting to come up. Not quite in the normal ranges yet, so yes, she is still immunocompromised, but she's been immunocompromised for almost a year now. So all in all, she is doing fantastic. She has had no issues with GVHD, which is the graft versus host disease. She has had no issues with fevers or anything. Just all the things that we were expecting, all the things that people warned us about. Did take the necessary steps to try to prevent those things from happening, and it looks like it has worked. We're both really excited to finally get to go home. We will have to come back at 1 month, 3 months, 6 months, and a year just for some follow-up visits, but we can live with that. We're excited to finally get to go home. I know she's excited to see the kids. Really, we're just bored now. She's feeling really good. We had to spend Thanksgiving here alone, but we went out to a nice restaurant, had some hibachi. Since the last video, we've just been walking around, eating, binge watching TV. Actually, Shayna has started working out again in the gym. She's feeling good about it, not out of breath like she was before because of the super low hemoglobin. And with the platelets being in normal ranges, she can lift weights again. I know as soon as we get home, she's gonna get right back on a horse. She won't have to worry about the bruising or anything crazy happening. So we're just really excited. Now here's the thing, this might be the last video we make like this because we've made these videos to keep our friends and family informed. Obviously they know what's going on, but we've also made these videos to put them in some of the Facebook groups to provide some motivation and inspiration to people. But it is amazing how people can take our positive experience and insert their negative comments and their negative experiences to, I guess, try to discredit the things we say. No, we are not doctors, we're not medical professionals, but we have talked to several doctors through this process to try to find the best option for us. And so, we are just sharing information, and it may seem like our information is always positive, and that's because we seek the positive information. So with all the negative remarks and negative comments that we get about our experience, we have decided to end this YouTube series here. Now, for anybody out there that may want some of that positive information or inspiration, hit us up in our messages. We will be glad to share that with you. But thank you guys for all the love, support. It means the world to us. We really appreciate you guys checking in. But that's it, guys. We are happy to say that this transplant to this point has been a major success.